Ted Owens, and this is Mountain Health Today, brought to you by the Tahoe Forest Health System, where we try to outreach and talk about all things healthcare related, issues that are important to you and me. Today our guest is Ryan Solberg, and we'll be talking about physical therapy. We'll be back in just a moment. Welcome to Mountain Health Today. I'm Ted Owens, your host. My guest is Ryan Solberg. Ryan, welcome, and thank you for coming back to be with us today. And for the folks at home, Ryan is the Regional Director of Therapy Operations, and you're going to have to tell me again, MSPT designation. What does that stand for?
It stands for Masters of Science in Physical Therapy.
Okay. Last time we talked a lot about the types of physical therapy and how you decided to get into this line of work and helping folks with their PT needs. Tell us a little bit in a brief format about the operation. You have 3 locations.
Yes, we have 3 outpatient physical therapy locations, one in Incline Village that's been there for 13 years. We have Tahoe City, it's been there present for 20 years, and also in Truckee, which is really the mothership of all operations there. We also have an inpatient department, and we have wound therapy, and we provide services for the extended care unit as well at Tahoe Forest Hospital.
Now, I recall last time you grew up in a family, your father was a physical therapist, and you started very young and you worked there and decided to go in this line of work. You're very passionate about it. Today, I'd like to take a little bit more of a deep dive into some specific types of physical therapy that you do. Many of the folks at home have had physical therapy needs in the past, myself included, but not on everything that you do. So let's start with something that we can all relate to, your sports performance program. Tell me about that.
Sure. Really, the sports performance program has evolved over years, and really this started out of the development of the different therapists that have specialties in those areas. So specifically in this region, skiing is probably the #1 activity that we do during the winter. Could be cross country and snow, and we have specialists in each of those areas. And we really curtail the program when somebody does come in and say they get injured and they want to return to that sport. We really try to make and gear their rehab that's specific to optimize their rehab to that highest level to achieve.
It's not always an injury that brings an athlete in. It
Sure.
could be an ache, or we talked a little bit about physical motion last time, something
Exactly.
they're unaware that they're doing, or a habit they've developed, correct?
Exactly, and that's really part of the sports performance program as well, is we'll get evaluations and requests for running evaluation, gait analysis, which is walking, and also cycle evaluations, and ski evaluations. And we'll do a deeper dive, and it might be a little minor injury or an ache that somebody had, or they just want to improve their performance and optimize their power output, their cycle, their spin cycle, and or maybe just reduce some of the neck pain that they experience on a bike. And so really we take that into account on the first day evaluation, and we build a program for them. We'll do everything from video analysis, movement analysis, detailed biomechanical screens where we actually utilize video and technology to go over frame by frame analysis.
Is that the type of thing where I've seen it actually on television, where
Sure.
the computer might pinpoint joints and things, and you're able to determine maybe imperfections in motion, gait, posture, things of that nature?
Exactly, yeah, and it's a really great educational tool, not only for to analyze the video itself, but for the education component to give it back to the client, whether it is just simple posture on the bike or while they're running. We're able to highlight the certain areas and actually measure physically, get objective measurements pre and post on that first day one. So individual may come to therapy and they leave with not only a full analysis of their motion, but some type of program that they can build into it to re-educate the way they ran or the way they will run in the future. So
I want to change it up just a little bit for a second. When we say sports physical therapy, a lot of folks in our region jump to the conclusion that that might be your professional athletes because we're
Sure.
surrounded with professional athletes here. But that's not necessarily true. How would you define sports?
Sports, I would say that we all have a definition on what really qualifies a sport, and we all have an interest, a genuine interest, and we have our passion is built around that and our goals. And despite whether you're a professional athlete, a recreational athlete, you want to achieve at that highest level, and we need to treat that individual like they are a professional athlete to that highest quality. And that's our standard of excellence when somebody walks in the door that every patient can expect.
Okay, well that is really good to hear, and I wanted to clarify that because I think to some extent we all consider ourselves athletes and
Absolutely.
Up in this region with the various things we like to do, and return to those activities doesn't necessarily mean return to the race, but it does for some, right? So
It's modified in many ways.
So let's talk a little bit, let's move on to maybe introduce a total joint program, and in our next segment after a break, we'll get a little bit deeper into that and talk about community talks, but talk about the total joint program.
Yeah, the total joint program really evolved out of, number one, our orthopedic surgeons and their program of excellence. That we are surrounded by some of the best orthopedic surgeons at Tahoe Forest Hospital that have driven the standards to the next level. So as a therapy group, we needed to do the same, and we really found that we wanted to develop a program to entail how a patient would get entered into the therapy program as preventative, so they would come to therapy as part of a prehab program, and then they would also do their post-op program. There would be education along the way as part of a total joint camp and a patient handbook as well, so that patient going into surgery was really well informed on exactly what was going to happen in their episode of care.
Okay, that would include both surgery and then post-surgery as well.
Exactly.
And we're gonna come back to that in a second. We're gonna take a break in just a moment, but I look forward to talking about that because at my age, I've moved through physical therapy as a result of surgery, and I know that folks begin to move into that total joint replacement later in life, and it's very important. So we'll be back in just a moment. This is Mountain Health Today. I'm Ted Owens, talking physical therapy with Ryan Solberg. We'll be back in just a moment. Welcome back to Mountain Health Today. I'm Ted Owens, your host. I'm talking with Ryan Solberg, who is the Regional Director of Therapy Operations for the Tahoe Forest Health System. Ryan, good to have you back.
Thank you.
Great conversation. We left off just a moment ago talking a little bit about total joints, and you had mentioned community talks and outreach programs, educational things. Expand on that for me.
Sure. One thing we've implemented 6 months ago was, as part of the Total Joint program, was a joint camp. And essentially what a joint camp would be, takes place once a month. Anybody that's scheduled for surgery, it's a volunteer basis, but we highly recommend that they participate with the camp because really we go over everything that will come up in their upcoming procedure and their post-op care and what they can do to plan for that event. Everything from making sure their house is safe, they have the right assistive device at home, their home is technically safe-proof the minute they walk back in, and we walk them through really the day one after they're waking up in the recovery room, what to expect. That therapy will get them up and ambulate, so we go over really all the gait training with a walker. We show them how to...
Where do you do this?
We do this at our physical therapy clinic as well. Okay. So, and part of that program entails a pre-op physical therapy visit where it's an individualized program where we go and we discover what range of motion limitations that individual may have, any physical barriers, social barriers, and we really like to have the caregiver, that the spouse involved with that care as well, to come to that visit so we can go over the whole routine with them.
And where can somebody find out about these programs? Community Talks, the website?
Everything is on our website, and you can go under physical therapy.
TFHD.com website?
TFHD website under the physical therapy and rehab, and you can find the list of all of our programs and the different sites where we provide therapy. And we provide the pre-op physical therapy visit at all 3 locations, Incline, Tahoe City, and Truckee as well.
And these are on regular cycles?
Yeah, the total joint camps are once a month, and pre-op physical therapy visits are scheduled on a daily basis. We like to have usually a week prior to the surgery date.
Cost?
Cost is actually, that's part of the program. It's a complimentary visit that is part of their total joint procedure, and it's educational, so we just look at it as a way to optimize the best outcome.
Right, the best result.
The best result.
Okay. Let's talk a little bit about injury prevention, and that's a very important component. You know, a lot of folks land in your shop because of bad habits, not just an accident, things of that nature. How important is prevention in your education with patients?
Absolutely. It's probably the most...
Or the public before they become patients.
Exactly. And that's what we're really passionate about, is not only the education. Oftentimes with therapy, we see patients after an individual has been injured, and unfortunately that's the case, but we do try to have a lot of outreach into the community. Number one, by providing injury prevention programs. Many of those are all listed on our website as well, but an example would be implemented with the different high school programs, where we provide different injury prevention testing measures for different sports teams. And a lot of them, the goal would be to identify any objective mobility or stability impairment which could lead to a potential injury in that sport.
So, do you aid the coaching staff, say at the schools, how best to execute a certain
Absolutely. We try
movement?
The best we can to reach out to the coaches and get involved with that sport and build that into the part of the program. Another advantage is to any person off the street can come into our facility and participate with an injury prevention program, and a lot of that would be to identify, number one, any mobility or stability issues. You don't have to be injured to come to therapy, and that is how we qualify that as a prehab program. So it's prior to potentially doing any rehab. We like to identify any, whether it's a postural dysfunction or a biomechanical issue that may come up.
You used a term a second ago, prehab. And I know some folks that have been involved in those types of activities where they were in advance of a surgery, for example.
Sure.
It's a lot easier for somebody that prehabs before, say, surgery and then physical therapy to come back than if you're dealing with somebody who is doing what we're doing right now, sitting on the couch.
Absolutely.
Doing nothing, and their rehab is, you're starting from zero. And that's a challenge, right?
Exactly. And that's the benefit with our system, is we have an incredible wellness department that we've coordinated some classes with them out of the same facility, out of the Truckee facility. And part of that would be a prehab total joint program. And it's a class that they can actually participate in. And it can involve anything from nutrition consult, weight management, to some of the strengthening that to get them ready for surgery, to get them strong enough for their post-op care.
Mm-hmm. Very important.
Absolutely.
I want to talk a little bit about something that I know nothing about, which is hand therapy. When I was in PT, I saw one of your folks working with somebody very specifically on a hand injury. That's a complete science in and of itself, is it not?
It is, and it's really evolved, and that department is what really makes Tahoe Forest Therapy Services very unique. And at all 3 locations in Incline Village, Tahoe City, and Truckee, we have certified hand therapists who provide the therapy for specific to elbow and hand. And it's a unique certification that's very distinct for a rural area that we live in.
Yeah, I remember we talked about that last time, because you might see certain injuries more in an urban setting, or
Sure.
in a less outdoorsy, sporty environment.
Yeah, we may see a little bit more of the trauma-related injuries up here,
Right.
just related to the higher risk sports up here. But again, we do see the occupational-related injuries, amputated limbs as well that we may have to do more extensive rehab for. So,
Okay. Well, listen, I think that when we come back, we're going to take a break in just a moment, but I want to talk a little bit more about hand therapy. There's a lot of things going on in a hand, and most people don't think about it, and some preventative things as well. Folks, you're watching Mountain Health Today. I'm Ted Owens, your host, and our conversation today is all centered around physical therapy. We'll be back in just a moment. Welcome back to Mountain Health Today. I'm Ted Owens, your host, and we're talking with Ryan Solberg, Regional Director of Therapy Operations for Tahoe Forest Health System. Ryan, good to have you back. We left off a moment ago on hand therapy. Let's go back to that just a little bit. People don't come to you necessarily from an injury. They might have something that's a tick, a trigger finger, things that are bugging them.
sure.
How do they find their way to you?
Yeah, a lot of times it could be anywhere from numbness of your 3 fingers right here. That could be the first sign of carpal tunnel syndrome, your thumb, index, and middle finger. So if you do have any numbness of those 3 fingers, that could definitely be a sign of carpal tunnel syndrome.
And you should go see your physician.
Absolutely go see the physician, discuss that with the physician, and see if you can get a referral to occupational therapy to see one of our therapists. Another highlighted area, probably the more common, is arthritis in the thumb region. So it could be anywhere from an achy joint right in this area, so that can be easily supported with a splint, a brace, a one-time fitting that with our occupational therapist. Home exercises to show things that you can do, exercises that you can do at home to help strengthen up that area.
And so the best result would be you solve the problem without surgery,
Absolutely.
pure physical therapy and exercise.
Modifying activities and implementing a home exercise program with the splint.
Okay, let's shift gears a little bit.
Sure.
You also offer aquatic therapy programs.
We do. That's very unique to our Truckee facility. We have a warm water pool, and we utilize that pool with anybody with difficulty with any gait issues. It can be anywhere from balance, vestibular, neurological. Maybe there's anything that weight bearing potentially poses a problem. And so we utilize our aquatic therapy program is probably most utilized with our total joint patients. So once the wound is deemed safe to go into the pool, we'll put that individual in the pool and we'll provide exercise with them.
Is the point of aquatic therapy more weightlessness, suspension, or is it
Exactly.
resistance?
Yeah, it can be both. It's actually a pool that can generate a current as well, that you can walk against that current. But it's really to be weightless and to be able to optimize your rehab without gravity. We're taking gravity away from it, so everything is just that much easier. So we can encourage. We can improve range of motion sooner. We can decrease pain. We can provide strengthening for an individual that otherwise can't do it with against gravity.
Okay, and conventional means.
Conventional means, yes.
You know, one of the things that's in the news and on everybody's mind a lot these days, particularly with sports, soccer, football, and even baseball, is concussion prevention programs. And skiers have been wearing helmets for many years, but we didn't know a lot about concussion or MTBI in the past. There's a lot going on, and you're involved in that regionally here. Why don't you open up on that?
Yeah, we're really excited to be a part of our concussion management program that system-wide within Tahoe Forest Hospital. We have many practitioners that have touch points in that program. Ours specifically, we offer physical therapy, occupational therapy, and speech therapy as part of that program. So if an individual does sustain a concussion, they can have anything from a whiplash, cervical pain. They may have headaches, dizziness, cognitive issues, language issues. They may have difficulty with motor planning and really performing their activities of daily living with fine motor tasks, grasping, gripping. So we have 3 individuals we actually have more individuals, but we have 3 different departments where an individual may have touch points and see our speech therapist for any cognitive and language issues. They may see our occupational therapist for any activities of daily living and improving really motor control and integrating really return to function in their daily life with activities.
Are there demographic differences between the folks that you're seeing? Are you seeing young athletes primarily? Are you seeing middle-aged folks skiing, or even folks that might have just suffered a simple fall in the home, older folks? What do you see the most?
Yeah, demographics definitely are in with sports, and we'll see it seasonal. We'll see football and soccer, head-to-head contact, obviously, which is really being avoided at all costs, but it does happen. And of course, with injuries that maybe are sustained with mountain biking, and we live in a very action sports oriented community, and so we do see more concussions more often these days. So we really built this program around multiple practitioners, with Nina Winans is the director of that program that really heads that up and spearheads the initial baseline testing that is done on a yearly basis with our unified school district.
That's at a bench line that you're trying to establish. If in the event an athlete comes back to you, then you can benchmark against it.
We can benchmark against it. And
are you doing preventative work, or is this part of your community talks, educational, how to, how not to do certain activities?
Yeah, and not to speak on behalf of Dr. Winans, but she integrates with many of these teams preseason and does educational talks.
In the schools? In the
ski teams, and does community outreach. And number one is to provide some type of education for the coaches. Coaches these days definitely have education. In Pop Warner football, they teach heads-up football. So I think coaches get this, and they know the standards in order to get certified for concussion symptoms, but hopefully that individual gets routed the correct location.
So it's not like the old days, not like my coaches.
No.
Heads down football.
Exactly. We're heads up football.
So it's smarter approach to being professional in your sport and preventing injury to yourself or others.
Exactly.
So I think that's very prevalent. I think that's fascinating. And of course, there's a lot of research and a lot to learn. I'm sure you keep up with a lot of that with you and your colleagues.
Absolutely. So the multidisciplinary approach is what is very unique about our hospital, and with our approach in therapy is how we'll work as a team, not only from Dr. Winans, our neurologist, Dr. Forner, our speech therapist, our occupational therapist and physical therapist, and nutrition or dietitian all get together and work out a coordination, a plan of care that's individualized for that individual that's going through there. So it's unlike any other program out there.
And impressively integrated. And people can find you at tfhd.com. And thank you for joining us today. This is Mountain Health Today, program brought to you by the Tahoe Forest Health System. I'd like to thank Ryan Solberg for joining us and talking about physical therapy. We hope to see you on another program soon. Thanks for joining us. I'm Ted Owens with the Tahoe Forest Health System. We've brought another episode of Mountain Health Today and a very interesting conversation with Ryan Solberg, Regional Director of Therapy Operations. Ryan, thank you so much for being here. And thank you folks for joining us. We'll see you on another episode soon.